My name is Frank Cotter. I've lived and worked and practiced medicine in Roanoke for the last 12 years. I'm an ophthalmologist and I'm a partner at Vistar Eye Center. I serve mainly as a consultant in the field of glaucoma, and I treat patients who are afflicted with the disease of glaucoma. I'm not an expert in healthcare, healthcare finance, healthcare antitrust, or anything else except glaucoma and some other diseases of the eye. And I don't want to pretend that I do know more than that. However, I think I have at least an average amount of common sense. And that common sense tells me that we have a big problem here in Roanoke when the Wall Street Journal, the most respected business publication in the world, devotes a front page, 3,000-word feature story on Carillion and how Carillion has contributed to the astronomical increase in healthcare costs in Roanoke compared to anywhere else in the state. I think the citizens of Roanoke have a responsibility and a duty to respond at these frankly alarming revelations that were in that article. And as the first manifestation of this duty, and the first manifestation of this duty will happen tonight. Because tonight we're going to unveil the new Citizen Coalition for Responsible Healthcare. The doctors, including me, are moving aside. There will be a non-physician president, Ken King, who you'll meet in a little bit, and a majority non-physician board. I'll introduce the board in a little bit along with Ken King. But first of all, I want to make it clear what tonight is about and what it is not about. And what it's not about, this is not about the art of medicine or how we practice the art of medicine. Because the doctors, nurses, technicians, and administrators at Carillion are all good people, good professionals, and great doctors, and I consider many of them my best friends. What we are here to talk about tonight is the business of healthcare. All right, we're here to talk about the business of healthcare. And what on earth has happened to make us go from the lowest cost area of the state for healthcare to by far the highest cost area of healthcare in the state? And we need to examine that. And I think if you're going to examine that, I would urge everybody to look at the 1989 antitrust suit that the federal government filed against Carillion. You can't understand this unless you look at that and read all 6 pages. You'll never read 6 pages in the English language with more bad predictions than that 6 pages. And let me just read to you one of them. The conclusion of that 1989 antitrust case was, in conclusion, the court finds that the planned merger, which I'll explain in a minute, would probably improve the quality of healthcare in West Virginia and reduce its cost. That was the conclusion. Back when healthcare was 20% less than Richmond and Roanoke. You see, what the federal government thought was, they thought it was impossible that you could merge 2 hospitals a few blocks away, merge them together, create one hospital in a town like Roanoke, and possibly keep healthcare costs down. And they brought experts in from all over the country arguing that point, that the first thing that will happen is you'll get bullying, monopolizing tactics on the insurance companies, and your costs are going to go up. So what happened after the 1989 decision when Carillion won the suit? The first thing they started doing in the early 90s was hiring physicians and acquiring practices. And they went from near no physicians to now having 500 physicians, along with this healthcare megagiant that controls and dominates this market. All right? So what happens at the negotiating table with the insurance companies? All right? Well, insurance companies say, we're either going to take this market share and pay the prices that you want, or we're going to be out of business because you control the market. So the insurance companies pay the prices. Where do the costs go then? The costs go to the employers. All right, the employers get stuck with this, okay? Employers, and I'm going to give you a couple examples in just a minute of what the employees are telling me and what they've written me. All right, where do they shuck it off on? Who does it go to after the employers? It goes to the employees, all right? And how do the employees get stuck? They get lower salaries. They have higher deductibles, all right? Who do the employees pass it off on? Nobody. Okay? That's the end of the line. Okay? Everybody gets their cut until it gets to the employees. All right? But you have to know where this started in 1989 with the antitrust suit. That's when this whole thing began. All right. What we all are here tonight and want to know is, why were we 20% lower in 1989 and 25% higher now and paying 45% more? Because wouldn't our life be a whole lot better if our health care costs were 45% less? And the answer is yes. Let me quote Sam Leinberg from the Wall Street Journal. It's a one-market town here in terms of health care. Carillion has all the leverage. He also is quoted as saying, the Wall Street Journal is quoted as saying, Mr. Leinberger, whose company has about 100 employees, says its healthcare costs have risen 50% over the past 3 years, hampering his ability to compete with contractors from other parts of the state. It's frustrating, he says. On our website, we've had a lot of business people call in, and I know most of these, I don't know all of them, and they tell me this in person, but I just took off the website what they said. Southpaw on our website. I got hit with yet another 20+% healthcare insurance increase this year. 10 years ago, I paid $362 a month for family coverage with a low deductible. I now pay $1,000 a month for family coverage with a high deductible. My claim history over that 10-year period? The uncomplicated birth of 2 children. The Wall Street Journal article painted a disturbing picture of Carillion that went well beyond the $4,700 colonoscopy and their pricing power. Here's what else we learned. One board member received $14.9 million for contracting work. Another board member is an investor in the on-campus hotel, and his bank was used for financing. Murphy sits on the board of that bank. The CEO of Carillion, the not-for-profit charity hospital, takes home a salary of $2.07 million a year. But be fair. This does not include a car allowance, a spousal allowance, and not even country club dues. The Wall Street Journal was clear to point that out. Murphy's predecessor, Tom Robertson, received a $7.4 million pension payoff in 2003, on top of more than $2 million in previous pension payouts. Now, if I was Mr. Robertson, I would gladly, after being given $7.4 million, couldn't you think he could cough up the country club dues for Mr. Murphy? I mean, it's the least you could do for $7.4 million. Carillion has placed liens on 3,920 homes last year alone. They garnished the wages of 5,478 patients last year alone. And I can understand a business wanting to collect money that's owed to them. I think Carillion and every other country has that right. A company has that right. If you're owed the money, you should be able to go collect it. No doubt about it. What you don't have the right to do is tell people before they get the care, not telling the people before they care what the prices are, then marking them up 4 to 10 times over the price of a facility that you just bought out so you could raise the prices. Then suing them in court for these inflated prices, charging them interest, and then saying, when they say, I'm poor and I don't have it, it's too late. You've been sued. There's nothing we can do now. We can't offer you charity care. That's what's wrong. Okay, and that's the misunderstanding about these collecting of garnishments and liens. You have to understand that. Everybody has a right to collect money. It's got to be a fair price that you go after, though. In response to these liens and garnishments, Mr. Murphy said this in the Wall Street Journal. If you're asking me if it's right in a right and wrong sense, it's not. But Carillion can't be blamed for the country's broken healthcare system. Well, I don't know about you, but for $2 million a year, I want better moral leadership from the head of my office.